It's interesting that your first question to me is about anxiety, because that's one of the major feelings that's driving so much of what we're doing. Is anxiety about not knowing exactly what's going to happen, and that's always the hardest thing for people. So I'm telling people to make sure they focus on sources of information that are reliable and trustworthy, like the CDC, like the World Health Organization, and the the LA County Department of Health has wonderful information on their website that'll tell people, what if I have these symptoms? If I feel like I'm getting sick, what should I do? I tell my patients, most people are going to be fine. They already know, for the most part, that it's the elderly with underlying medical conditions that we're most concerned about. And the usual stuff, the hand washing and the fist bumping and elbow bumping and the 6 foot distance. And I'm glad to see you guys are doing that here. I'm by myself here at the desk in another part of the studio. But I'm trying to reassure people that if they do get symptoms, it's likely to be a mild illness. And I'm reiterating what I'm hearing from local hospitals and the governor and the mayor and these websites that I mentioned, which is, if you have mild symptoms or a fever, call the doctor. Don't go to the emergency room unless you're having severe difficulty breathing. If it's an emergency, go to the emergency room. But if you just have symptoms and you think, I don't know if I have coronavirus, and you want to know, call your doctor. Don't just show up at the doctor's office, because we don't want to expose other people either.
Well, those are very, very good suggestions for sure, Doctor. There's so much information, and people are trying to just keep a little bit and separate some from others, fact from fiction, if you will. Like this, people are being told to stay in their homes this week, but they still have to get groceries and do some essential things. So how can people protect themselves if they do need to leave the house?
Great question. And they should leave the house. People will feel stir crazy. Get out and get some fresh air. It's fine to be outdoors, and it's fine to go for a walk in your neighborhood. We just don't want people around crowds. You're going to need to go grocery shopping. Go grocery shopping and sanitize the handle on the push cart, the grocery cart. Most supermarkets now have a little dispenser of those things at the entrance when you walk in. And then wash your hands or use hand sanitizer as soon as you leave the grocery store as well. But don't be afraid to go there, or a pharmacy.
That sounds great. I happen to keep like some hand sanitizer in my car for just that purpose, Doctor. When I leave an area like the grocery store or something, I have it right there. Let's talk about the safety for children and grandparents. What if your kids are at home, like most are right now? How do you make sure that they are safe from the virus, and how do you also make sure grandparents are safe, especially if you're all together?
I think your second half of your question is the most important part, because as far as we can tell from our experience so far, kids don't have the most severe forms of the illness in most cases. They get mild symptoms, but they can carry it to an elderly grandparent. You're right. And so if there are young children and elderly grandparents, then it's important that people are self quarantining or staying home, and that they're very careful about who else comes in the house and comes in contact with the elderly individuals. Kids are going to be kids. And I think it's even fine to have your kids have a play date with another family where your two kids go play with their two kids. And as long as no one's sick in either household, you should do that sort of thing.
Okay, so we're talking about, yes, less than 10 people getting together.
Exactly.
Unless you have a huge family, and you know, well, it's a really huge family.
Right, so no family reunions at the moment.
All right. Dr. Barron, thank you so much, and I appreciate the levity during this time. We can use everything, especially some smiles when we can. So thank you so much for your advice.
My pleasure. Thank you.
All right.